Varicose veins can be both a painful and unsightly problem, but now new technical advances are making it easier to get rid of them, often in a single procedure. As an avid runner and mountain bike rider, Raquel Mieno's legs are toned, but there's one small area that bothers her.
Right now, I'm a little ashamed of my left leg. When I'm out running, I feel like I need to hide it.
She says the raised veins faintly visible on her leg when she's lying down bulge out when she's standing or running, forming a rope-like pattern familiar to varicose vein sufferers.
And that's why I'm getting this done, actually, because with my running gear, I don't like to see the bulgy veins.
But today, Novato surgeon Dr. Joel Erickson is going to treat the area with an increasingly popular combination therapy. He says it replaces older techniques that, while effective, often required return visits.
First, to close the long, straight veins, but that doesn't take care of all those little varicose veins and big, medium-sized ropey veins. This is a time where I'll need light down again.
First, Dr. Erickson uses an ultrasound to guide a laser into the larger saphenous vein, which is feeding the problem area.
You can put the light up, and we'll activate.
100.
Over the course of the next few minutes, he'll use heat from the laser to kill off that vein, a process known as thermal ablation.
So this vein eventually gets destroyed because so much heat is produced that the vein becomes literally seared or cooked. And that's it.
2691.
The next step is to destroy the bulging veins using an evolving technique known as foam sclerotherapy. It involves injecting a liquid agent into the problem vessels to kill the tissue. He says the challenge in the past has been to keep the solution in place. To help that process, Dr. Erickson whips the solution into a foam state to make it less likely to be diluted by any residual blood flow.
If blood gets back into the vein that's been treated with sclerotherapy, then there's a chance, or a reasonable chance, that the vein can recover from the injury.
In the final step, Dr. Erickson injects liquid under the skin surrounding the veins to compress them, ultimately wrapping the leg in a compression sock. The effect can be long-lasting. Salsa dancer Julia Sanchez underwent the treatment several months ago.
Oh, God. Yeah. Improve.
All right.
If all goes well, Dr. Erickson says Raquel will avoid a second surgery, often required in the past.
Well, she should be back on her bike within 1 week. She can run. I've told her she can go running after 2 days. Her prognosis is great.
And one note, while commercial versions of the foamed chemical are in use in Europe, they are not yet approved in this country. One British company has just submitted a new product application to the FDA, and they're hoping for approval within the next few months.